Hello, everyone, and welcome back to the MedBoys podcast. Today, we have with us Dr. Sagar Desai, a distinguished board certified orthopedic surgeon. Dr. Desai is currently a foot and ankle surgeon here in Toronto, and he specializes in various types of surgeries ranging from minimally invasive techniques to patient specific total ankle replacements. Among his numerous accolades, he's a surgeon educator, a social media influencer with over 50,000 followers on Instagram, and the founder and CEO of Proven Therapeutics, a company specializing in perioperative surgical nutrition to help patients optimize their outcome from surgery. Thank you so much, Dr. Desai, for taking the time to speak with us today to share your insights about your journey through orthopedics. How are you doing today?
Very good. Thank you guys for having me.
Thank you, Dr. Desai. I want to ask you the first question. So,
Sure.
what inspired you to pursue orthopedic surgery and specifically foot and ankle?
So I think you guys are probably in a similar situation, being in kind of the middle of your medical school. I think probably within medicine, and I think probably in general, whether it's law, corporate, corporations and whatnot, in business, you kind of make your decisions somewhat in an uneducated way, meaning we haven't really been exposed to everything. So we're making a decision about our entire life based on a small amount of information. And for me, it was an interesting story where I went into med school thinking pediatrics. At one point, I switched to plastics. I thought about trauma surgery, thought about cardiology. I had a bunch of things in my mind, and I was in third year medical school. And I'm not sure if it's the same right now, but around third year or so, you kind of have to decide because you have to make sure your electives are lined up to what you want to do. And I actually I was confused. I didn't know what to do. I emailed one of my friends who's an emergency physician because I just decided to do emerge. I just decided I wasn't really sure what to do, and he didn't email me back, which is weird for him because he's a good guy and like we talked a lot. I guess he must have just missed it. Like he was someone who always responded, and he's the only guy I knew in Merge. And then I looked it up online and I emailed. The next email was to the doctor at Toronto East General. His name was Bill Kramer. He was at that time the program director at U of T Medical School, at U of T Orthopedics. And you guys are all like in high tech, like we didn't have a. It sounds I'm dating myself a bit. Like I didn't have a phone, right? Like we didn't really have an actual phone back then. Not that it was that long ago, but so it's you have to check your email on the computer, right? So um, now I check emails every 30 seconds, right? It's very different. So, but he emailed me right back right away. So he must have been at his desk, and he said, "Yeah, come join us." And it was just a shot in the dark. I didn't want to do orthopedics at that point, and then within about a week, working with him, I had a great time on his team. We got along really well. It's a really fun experience, and just like that, I canceled all my electives and chose orthopedics.
That's an amazing story, Dr. Desai, and I can relate to that a lot right now. We had electives, like we had to pick our electives about a month ago, and I was also someone who was just thinking of a bunch of things. I came into medical school, almost all three of us wanting to do neurosurgery, and that's super funny because I've seen your posts on neurosurgeons. They're
Yeah,
really, they're really funny. Um, and
no,
then
it's tough because it's your entire life, right?
exactly.
But at the same time, I look at it, and multiple people reach out to me almost every day asking about advice about this, and I look back and I said, well, what if he responded to my email, right? What if he
Mhm.
responded? I was an emergency. My life is completely different. I
Right.
probably wouldn't be in Toronto. It'd be a completely different life, but I would have my attitude towards that job would be the same, and I would probably be happy. You know what I mean? I wouldn't. I would look back saying, well, thank God I didn't do orthopedics, right? So it's if you have the right attitude, I don't think you can really go wrong because if your approach is correct, it's like that's what you're meant to do, and I think that's the best way to look at it.
Yeah, yeah, and that's kind of what I started thinking too. That like I honestly stopped thinking about it too much because I felt like I was overcomplicating it. And then I was just like, let's just go with the flow. And then this is something that I kind of reasoned and thought would be the best career path forward. Hopefully it works out. But
And sorry, that's orthopedics.
yeah, that is orthopedics.
Okay,
Yeah,
okay, perfect.
yeah. Um,
I think it's a good field, obviously. So yeah,
so it's a great field. I had osteomyelitis as a kid, so I got exposure
oh
really
wow.
early in life. So it'd be a full circle moment if it does work out. What I wanted to ask you is you've worked with a lot of orthopedic surgeons. Do you think there's certain personalities that are drawn to orthopedic surgery? And what are those personalities?
Well, the classic, obviously, you guys know by now, the classic stereotype is the athlete, right? Orthopedic surgeons are big, strong, tall, whatever. And I think that comes down to, usually, like, I played sports when I was younger. I played basketball. That was my thing. And I get exposed to, just like you mentioned with osteomyelitis, very a rare problem, but I got exposed to sports injuries as a teenager. So I spent a lot of time in sports clinics. And that was my first exposure. I think a lot of us who played sports since we were younger get exposed at a very young age to athletic injuries. So I knew anatomy pretty well because I would injure coincidentally, I hurt my ankle multiple times with ankle surgery. And so I got exposed at a very young age to athletics, athletic injuries, sports medicine, anatomy, rehabilitation, physiotherapy. I was surrounded by it. So I think automatically the quote unquote athlete is drawn to that for that reason. And in general, like, obviously there's exceptions, but they all have a certain similar personality, not just physically, but also just in terms of their character personality. So I think that's at least where orthopedics kind of gets that specific type of person, is just their initial exposure.
Yeah, exactly. And I think that you've kind of meant like obviously portrayed yourself and you've portrayed orthopedic surgery as well as the other surgical disciplines in many different ways throughout your social media page. So I think that also kind of gives a little bit of insight into kind of like your mind as well as the mind of the medical field in terms of these different specialties. But I guess that's sort of rewinding back to your training years. So, obviously it's a really difficult time. Residency is super challenging. You're being pushed to like new limits every single day. And a lot of the job is it's like on the job learning. It's like putting in those nights beforehand to learn those new procedures, learn those new skills, and then eventually applying them in the operating room. So, what was your actual approach to learning new procedures during your training years?
Yeah, so you're right. Residency was challenging. I was in a very old school program where we had morning rounds 5 days a week, and those morning rounds are not just you go and listen to someone talk. It's just you're getting grilled the entire time, so you're prepped for it. So my general approach would be, the night before I would read for my surgery case of the next day and read for rounds. And then what I did was, especially both in residency and particularly in fellowship, is after every case, and this is again before we had like really cool phones, I had a voice recorder. It sounds almost ridiculous that I had a separate voice recorder because you can do it on our phone now, but I had a voice recorder, and after every case, I would, quote unquote, dictate the case in my voice recorder, and so to make sure I memorize the steps. And we're not talking about, okay, like cut the skin, cauterize. We're talking about, or at this stage, Dr. So and so put his hand like this and put the retractor here and did this, and then like very specific things. And so I recorded it, I saved it as X file for whatever surgery. And then when I became a staff and a consultant, and I'm doing that surgery now again on my own, I go back to that same recording, listen to it, and I actually typed it out as well. Listened to it, read it again, and then it just stuck. And then it just became that I did it for the first probably 2 years, year to two. And now it's just obviously like second nature. But that's kind of how my approach is, that you learn a technique and then you don't see it again for a year. To me, I don't care. I mean, some guys are smarter than others, and I was not someone who just picked it up and then grabbed it again a year later. So I dictated it, wrote it down, and to me that was a really valuable thing. And it takes like 2 minutes. It wasn't a hard, especially now it's your phone. You don't even need a recorder. You just take your phone. You have it if you want to have an AI program even, and they'll actually make notes for you. Like, it's so much easier now to do that. That's something that really, really helped me.
That's actually a very interesting approach, and I think it's also very unique in that sense. A lot of people might not choose that route of learning. And I think even in medical school, there's a lot of times where students have their own way of learning. And, we've heard about imposter syndrome and medical school itself being a daunting place. So just like you approached residency, I want to take you back to your first year of medical school. And if there's one advice you could give to yourself or others in their first year of medical school, what would it be?
It's a good question. I found medical school very straightforward because to me it was your last time it's the last time you're in school, right? Because once you get to kind of third year, like, clerkship in third year, and especially in residency, it's not really school anymore. You know what I mean? And as much as I would never, like, respectful to you guys, I would never want to go back to those days. I do kind of miss being in school a little bit, right? School, it was kind of fun. I was a social director at U of T, which means we planned parties and planned all these events, and it was actually a lot of fun. And the first 2 years of med school, as you guys know, first year, I'm not sure if it's different now. First year was actually pretty challenging academically. Second year was a bit easier, but I I I think I did this because I think in the moment I was mature enough at that time to realize that my school was ending soon. So I think the best advice would be to, like, enjoy the fact that you have that last 2 years of school, and enjoy the experience. Because once the clerkship starts, and certainly once residency starts, you're just, it's not school anymore. It's a job. It's grueling. You're a bit older. You may have a family by then. There's so many things change that I kind of miss kind of being in school, if that makes sense.
Yeah, yeah. No, that's the exact advice I gave to Rushal, Dr. Desai, because when I started my third year block, I had surgery first. And I was like, Rushal, just enjoy your second year because
Yeah,
after this, it's over.
it gets real. Yeah, yeah.
I wanted to ask you about orthopedic surgery again, something more specific that people don't really understand. So, what do you think it is about orthopedic surgery that people outside the field don't really appreciate enough, whether that's other doctors or the public?
That's a good question. I think the stereotype is that it's like, the dumb guys and girls in medicine, and you don't do a lot of medicine, um, which is true. Like, there is not a lot of medicine involved, right? It's very different than, a medical subspecialty, obviously. Um, the fallacy that, the less intelligent people go into orthopedics is, I just think, untrue. I've seen some of the smartest people I know are actually orthopedic surgeons, so that's one thing for sure. Um, we also get, kind of the reputation that we just use big hammers and tools and everything, whereas neurosurgery and all the other surgery are fine with your finger. That's just not the case. In a lot of cases, we do a lot of big saws and stuff, but there's a lot of, it's not technically, like, I made a post a couple of weeks ago, where it was me, but a cardiac surgeon walked into a room and was making fun of ortho for doing a bunion. Someone who does that surgery, it's technically very tricky. Like, it's not easy to do it well. And I did that jokingly, obviously making fun of myself, but knowing that I do that it's a tricky operation. So I think just understanding that it is a very complex field. It is not technically easy. You don't just use big hammers. And that's one of the biggest, stereotypes that even I had before I started orthopedics. And I realized very quickly it's simply not the case.
Yeah, absolutely. And I think I was speaking to, I believe, a PGY1 vascular surgery resident. I asked him why he wanted to do vascular surgery, and one of the reasons was because it was one of the surgical disciplines with the highest skill ceiling, as in it's the one where you require the most amount of precision and the most amount of technique to perform those procedures with proficiency. Of course, orthopedics, as you mentioned, has its own sort of technicalities. And of course, within disciplines, there are so many different so many different levels of proficiency within surgeons. So, what do you actually think is what separates a technically skilled a surgeon from for someone who knows kind of all the surgical techniques and all the procedures really well from a truly great one?
It's a good question. I think that, like, even taking a step back, what I've learned is, you know, when you look at what makes the good quality of a surgeon, I think the first thing is maybe surprising, is not actual technical skill. Um, Obviously, some surgeons have better hands than others. You guys have probably seen that already, and I've seen that too in my career. Um, but I think the biggest thing that separates surgeons is actually what they do outside the OR. And to me, just deciding what patients to operate on and which surgeries to do, to me, is the number one thing of a surgeon, right? So, you know, and that's what you get with experience. Obviously, with experience, you get better technical skills. I'm technically better than I was 5 years ago. But I think what I'm much better at is, how do I assess a patient, get an understanding of all the factors that are related to that patient, their personality, their character, their job, what hand they write with, what their motivations are, what their expectations are. There's 1,000 things you look at. And when you meet a patient, you see them for 5 minutes, it's often hard to go through all the different things that you need to go through. But that's where you become quite skilled, is learning when the right time to operate is, and then learning what the operation is. That's number one before you even step into the OR. Then once you get into the OR, I think the technical aspect of things is the third most important. The second most thing is how do you deal with things as they arise in the OR. And we've all seen surgeons get flustered very quickly, and then we've seen those guys that those just like nothing bothers them. You know, you're in a trauma situation, everything's bleeding, and they're just like so chill because they've seen it before. And then the third thing is the technical skills, and that's a good question. I think how to become technically good at something is just like anything, like whether it's a sport or anything, you have to practice. And practicing outside the OR, like when I was a med student and a resident, you know, we had those suture kits, and we're just practicing all the time. I'm watching TV, I'm learning my hand ties, like practice. And then I think eventually there is a ceiling, right? Just like in athletics, like you can work as hard as you want, and you know, the next guy beside you might just be better. And I think there is a ceiling, and I think the key is just to get as good as possible. I think as good as possible, combined with the other factors I talked about, can make kind of anybody a pretty good surgeon.
Yeah, that's actually a very good thought, and it ties into a question that I wanted to ask you related to complications that could possibly arise during surgery. So, how do you and your operating team manage a complication that might arise during surgery? I know you touched on, staying calm, but what are some other factors?
Yeah, no, I think the first thing is just obviously experience, right? Um, you know, being in a situation like I look at myself, I'm 10 years in. When I first started, something goes wrong. I remember how I acted compared to how I act now. Obviously, things go wrong a lot less now because I'm much better than I was. But if something does come up, the first thing is realizing the surgeon in the OR kind of sets the tone of the room. That's whether there's a complication or not. Even just on a regular day, the surgeon sets the tone. And that's number one. So when you do run into a complication and you have enough experience, it's just kind of staying relaxed. And also with that experience comes, you know, like for example, I'm doing a surgery. Like if I'm doing an ankle fracture surgery, which I do a lot of, I kind of know what every single possible thing could go wrong. I know what could go wrong, and if something goes wrong, I know how to react to that. So I think with experience, just one, having the disposition to stay calm, and then two, if something does go wrong, I kind of know what to do. It's not like I have to panic. It's like, oh, the screw didn't hold properly. Well, I have plan B. Oh, that doesn't work. Plan C. That doesn't work. Plan D. Like there's no, like, the OR is the least stressful part of my life right now because I've seen it all, done it all. It's just a calm environment. So I really think how you manage it is number one, your disposition, and number two is just experience. And there's no way to get experience other than experience, right? Getting operating, seeing as much as you can.
That's a really good way of looking at it. And I feel like the experience kind of comes with time, and then everything else you can kind of work on while you're doing that. So from the things you were talking about, we can kind of see that orthopedic surgery is physically demanding, but also mentally demanding. So how do you ensure that you maintain longevity and don't burn out and prepare for this long career?
So that's a good question, because there's a lot. It's a very loaded question and there's a lot of different things there. I think to me the biggest thing, if you want to just look at longevity within orthopedics, you can look at everything from like your body to your sleep to your rest to how you manage your finances. Like there's everything, right? Like you can go on forever. In terms of just purely physically, um, my experience is that during my residency years and my 5 years plus 2 years of fellowship, between ages of like 20, I guess like 28 to 35 or something, I probably aged double, right? Like I probably aged in 7 years, probably 14 years. And then once you start working, everyone's like, oh, you finally got a job. You've made it. But then you have to work hard to pay off your loans, right? So then it's another 5 years of just working like crazy just to pay off all those years of school. And next thing you know, you're now like 40 years old and you're halfway through your life and you're in like the worst shape of your life. So my experience has been I kind of recognized that about 5 or 6 years ago for various reasons. And I really took a very active role in terms of how to maintain my body and my mind in the OR to give myself the longest chance possible. So number one, like I completely changed my diet. So I eat very differently. I sleep. So like I track my diet. I track every single calorie that I eat. I sleep 7 hours a day. I never slept 7 hours a day in my entire life. Like in residency, I would sleep 2 to 3 hours a day for 5 years straight. Now I go to bed like at 10 o'clock. I've never done that before, but it's changed my life. So I sleep, I eat properly, and then obviously I exercise. That's really important. From an orthopedic perspective, I try my best to work on my core, my lower back, to avoid any back problems. I try to do my cardio, increase my VO2 max for a lot of different reasons. So I think it's really important you start realizing. I realized late 30s, early 40s, you're now kind of 5 years into your career, and you've like literally just held your breath for the last 15 years of training and early. And you start it hits you it hits most guys when they get an injury, or they start feeling back pain, and they realize like what, I need to start changing how I do things, otherwise I'm gonna have a very short career. So I approached it in various different aspects, and it's really kind of helped me at least at the stage now where I'm the healthiest I've ever been, and it will give me the best chance long term of having a longer career if I choose that way.
Yeah, absolutely. I mean, physical and mental health will always be some of the more important foundational things in our life. I was always told by Nimit and a few of the upper years when I was in first year that you could spend these first 2 years in med school really developing those healthy habits, because if you don't make enough time for them now, it's going to be really, really hard when you have to stress about spending like doing like 12-hour shifts, going 26-hour shifts on call. It's just so much harder to manage your health when all those things are kind of hitting you all at once. So yeah, I really respect kind of like the routines that you follow. Also because I track my own calories. I've been tracking them for 2 years.
Nice,
Just
nice.
because yeah, exactly. It's like it honestly is life.
Well, the other thing too is like we don't realize this, but when I was in university and when we were in university, like you guys don't remember this, but McDonald's had this like every day they had a sandwich that was on sale. I can't remember what it's called now. So every Saturday was the McChicken sandwich, and every week I would have two at like 2 in the morning, and it was terrible for your body, right? But we're also like I was also running and training 10 hours a day. You also realize that you get older, right? It's pretty obvious. So you can't, as you get older, you can't really do that anymore. And you can't, what you guys are doing now when you guys are in your late 20s, you can get away with certain things, but then if you have the same habits when you're 35, 40, 45, 50, that stuff catches up to you. It's just not, it's just harder to, you just can't keep doing that to your body. And people do that and it shows, right?
Yeah, well said. Exactly. And you've clearly put in so much work to get to the point where you're at. And I'm sure you must have experienced so many rewarding moments throughout your career. But if you were to highlight one of those, what would you say would be kind of the most rewarding moment you've experienced thus far?
Good question. So I think in fields like trauma, other certain medical fields, saving somebody, quote unquote, saving someone's life is something you see often. In orthopedics, unless you're dealing with a lot of trauma in a level one trauma center, you don't see that anymore. I did a lot of that before, but not anymore. But to me, like the one that just automatically sticks out as an orthopedic surgeon, being able to change somebody's life that's not, not life or death, but change their life is I had a young guy. I've done about 10 of these young people now, but the one guy sticks out. He was 19 years old. He had a very rare neurologic disorder, and he basically had contractures of his ankle. So basically, he walked on his toes. He's an Indian kid. He was 19, good looking guy, 6'3", like a big guy, big strong guy, but he walked on his toes. And you can imagine, number one, how difficult that was just for him to walk on his toes. Number two, also just socially, the way he walked, he looked very awkward walking. And not a single person, if you saw him walk by, you wouldn't notice that, how he walked. And that kind of, he was very quiet, very reserved, partially as a result of that. And then I did Achilles surgery on both sides, Achilles lengthenings, the 2 years, it was about a year and a half process. And at the end of it, he just walked normally. And to me, like I remember seeing him, his parents were like literally crying. It was the coolest thing to see because their kid had never walked and looked normal in his life, and he's able to walk normally. So that one's like I've had a bunch of those patients, and he's the one that just kind of I can name probably 20, 25 young people, teenagers that I've done in similar situations, and he's the one that just sticks out because it was relatively recent, and that was just really cool. It was just cool to see that this not only is he functioning better physically, but you can see how that is going to change his life in every other way as well, mentally, emotionally, every other way. So that was probably one thing that really sticks out.
I think your story is real evidence. A lot of doctors mention that you shouldn't go into this field if you're trying to, if you're looking for a higher salary, you shouldn't focus on going into medicine. Or they talk about a lot of benefits, but the biggest benefit they talk about in medicine is how rewarding it is. And I think your story, you've accomplished a lot in your life, and using a patient's experience as a rewarding story is truly inspiring. And I wanna share something that we've done as a collective with MedBoys, which is we started this YouTube channel as a source for us to learn more about the medical field and also to help the students that are applying to medicine. And as we were going through the process, a lot of students actually came up to us from our university and other universities telling us that our resources were actually really helpful to them. And the videos that we were creating were helping them. So I want to pose the same question to you. What inspired you to start a social media presence in the midst of your career?
Um, well, I'd say about 4 years, 3, 4 years ago, I don't have Facebook. Um, I didn't even know what Instagram was. I didn't know what TikTok was. Wasn't something that I really cared much about. And I don't remember why I started it, but I did. And I think initially, um, I did a lot of talks. I did a lot of surgeon education. So I do a lot of teaching to this day to other surgeons, and so I'd film a lot of my surgeries. And I think initially I just started posting like surgical videos on like step by step techniques. And obviously, it was very early on. This is probably 3 years ago, maybe 3, 4 years ago, and it was a lot of work. Right, I was already busy enough to cut these videos by myself. It was a lot of work. Number one, then you'd post it, and nobody really cared. To be honest, it was it obviously had a very small following then. And I think about 2 years ago or so, I don't remember why. I just don't even know why I did this. I just posted a funny video. And that time I got like, I think 10,000 views at that time which was like way more than I'd ever had in my life. And I started realizing like I would turn to social media just to get I personally just look at fitness stuff, basketball stuff, and just to have a laugh. That's it. You had a busy day, you're tired, you're exhausted. That's a bit of an escape to go and just laugh about things. I really started realizing people start wanting to laugh about things. And I have a bit of a dark humor. I wouldn't consider myself like a funny guy. I'm not a life of a party. I'm quiet. Despite what you would think, I'm completely an introvert, like 1000%. I would choose staying in to watch TV than go out any day of the week. I hate going out for dinners. I don't do any of that stuff. So it's puzzling because I put myself out there in front of thousands of people. But I just started doing that out of fun and then just making stupid videos. The next thing you know, like 2 years later, I went from 10, 20, 50, now to almost 60,000 followers just by sharing experiences in a hospital, which everyone can relate to, whether it's patients, other physicians, nurses. And it's been really cool. Like you start seeing these patterns of, you post a video and you get a comment from the Philippines. Like I've had people send me gifts from all over the world thanking me because it just makes them laugh. And it's interesting to start seeing like you post a video about an orthopedic surgeon interacting with the neurosurgeon, and some guy in Australia texts me saying it's hilarious because that's exactly what it's like there. So you start realizing the world, this kind of healthcare is kind of universal, and everyone has the same experiences all over the world. So that kind of stuff kind of motivated me to do more. So I initially just started doing funny things. Next thing you know, it just a couple. I had about 10, 15 viral videos, and next thing you know, now I just have fun with it. It's purely just for fun. I have no financial interest in it. I don't make any money off of it. I don't take any sponsorship stuff. Haven't done any collaborations. I just cut my videos between cases, and it's fun.
I will say, Dr. Desai, they were very, very funny. And sometimes when I get onto your account, I'm just scrolling to yeah, because I keep finding funny videos. And I was doing that today too, before the podcast, and I was just laughing a lot.
Well, it's funny because like nothing there is like necessarily just a joke. It's just
Yeah.
you're stretching kind of the truth, right?
Yeah.
And when you're in medicine, whether it's medical students, residents, staff, nurses, patients, like it's all just true with a little bit of an exaggeration, and
Yeah.
that's what makes it, I think, kind of funny that everyone can relate to it in some way.
Yeah. And honestly, I found that in my experience, the best actors are the introverts. Because I feel like
Interesting.
you have a lot of like your acting skill is very good. Like when you're all these different types of surgeons, we completely believe it, and we know that you're an orthopedic surgeon. So it's
No, it's
actually
funny. Some people text me like, "Oh, like how long have you been doing neurosurgery for?" I'm like, I'm not a neurosurgeon, but no, I'm kind of like it's acting, but it's so easy for me
Mhm.
because you're not actually acting, right? It's like literally like I make sure my videos are less than 10 seconds. I shoot it like most of my videos. I take one or two takes. I just take it and I'm done. And so there's not much thought behind it. It's not like I have to like prep myself or like it's like a big dialogue or monologue. It's 10 seconds. It's easy and it works pretty well.
Yeah, our favorite videos on our channel are definitely the skits that we do. Like we do a
Yeah.
bunch of skits where we say med student comes to a Christmas party or med student visits the doctor, and we laugh so much when we're filming those videos that they take 3 hours, but
Okay.
they're the best videos.
They're fun though. Yeah, they're fun for sure.
Exactly. I wanted to ask you, like, obviously, there's a lot of fun that comes with this, but there's also a lot of other things that come with maintaining an online presence. And you're a practicing surgeon, so you're still in the field and you're doing all of these things. So how do you balance being an active surgeon and also have this online presence? Because it probably affects the way people act around you as well, right?
Yeah, I think just in terms of timing, like I don't take a lot of it doesn't take a lot of my time. I would shoot. I'll think of a video sometime just on the spot. Like my most popular video ever was just one of the videos where I probably saw it where I just peeking into different surgeons' rooms, listening to the music that was playing. And I thought about that in the morning, and I just shot it between cases and sent it out the same day. I just think of something and I film it and move on. I don't spend hours and hours doing it. Number one. Number two, in terms of how it's kind of changed my practice, it's more just kind of helped me in terms of interacting with my patients. You'd be surprised the number of people who have Instagram, and it's always funny just to have chats with my patients. Sometimes I had a guy yesterday. He was like 80 years old. He's like, "I love your Instagram. It's hilarious." It was kind of cool just to chat with them about it. So it's not always the people you'd expect that have Instagram. It's like everyone has it. And the third thing is just it also taught me a lot about how to interact with people I don't know. Like, for example, all my colleagues at my work know me pretty well, and I can make a joke in front of them and they know I'm joking. But I realized relatively early on is that if I do that in a very public setting, people don't know who I am. So you see a lot of negative messages when I wasn't intending to be malicious or anything. And when you have 2, 3 million people look at it who don't know you, I started learning that I have to portray myself in a way that is respectful and portrays me as a person, and there's no room for interpretation. And it's really changed in terms of how I present, because I present myself at work in one way and everyone knows me, but I present myself a way on Instagram. So every time I post something, I take like literally 5 minutes to think about, would this offend anybody in any way, anyhow, anything? And if it does, I won't post it. Like I've had some great posts that I've actually showed some of my nursing friends that say, hey, take a quick peek. Could you see anyone getting upset with this? And I had a couple of great ones I loved. And they're like, yeah, you know what? Maybe you shouldn't do this. So it really kind of made me aware of how I present myself, because it's obviously very important. And I want people to gravitate towards me and not think I'm a bad person. And so it's challenging to kind of balance everything.
Yeah, of course. Being in the healthcare field, I think there's also a level of like, uh, I guess we also possess a level of like authority, in the sense that uh, people kind of look to like medical providers, even online or in person, as like people that are professional, like they hold a lot of responsibility, like these are like our role models in terms of health. So I think like it's always you always have to walk a very fine line to kind of like balance that responsibility while also showcasing yourself and kind of doing what you want to
for
do,
sure.
right?
And I think
Um,
just being, I think because, like, for example, like some of the most popular influencers are like dancing and stuff, right? Um, I would never do that because I think that crosses my line, but they are just being themselves. And I think people respect that, right? And they're just being themselves. And I think people respect the fact that they're themselves. And I think it's really important to just kind of be who you are. And if you start doing it, some things outside of that, that's when it starts looking a bit tacky and doesn't look natural. So I always keep that in mind as well.
yeah, exactly. And speaking of, being kind of who you are and kind of uh, yeah, focusing on kind of like your hobbies and your interests. You beyond surgery, you're involved in like several educational initiatives. So what motivated you to kind of expand beyond clinical practice?
Yeah. So in terms of educational initiatives, I think so. I do a lot of surgeon teaching. I do a lot of surgeon education. I'm going to do a talk tomorrow out of town and doing a lab to teach surgeons a new technique. To me, it was important for me because if you look in, like, I'm in a non-academic environment. In an academic environment, which you guys are in, you guys go into a surgeon's operating room. That surgeon kind of needs to know everything, and they're motivated to know everything because those students are going to ask them questions. So they're inherently motivated to stay on top of all of his techniques, stay on top of the literature and everything. They kind of have to be, otherwise, they look kind of dumb. In an environment where I'm not constantly challenged by residents and students every single day, I do have the odd one, but not very often. For me to stay on top of everything, this is the way I do it by like I work as a consultant for a couple of different companies and I go teach for them. Like when you go to that level where, for example, tomorrow I'm going to teach in front of all their orthopedic surgeons, you can't BS anything, right? These guys are your peers. In most cases, they're a lot older than me, right? Most of the time, I'm the youngest guy in the room, and I'm teaching them a technique. Like, for example, I'm an expert in Achilles tendon injuries, and I go do talks all over the world about this. You can't go and do that talk without being an absolute expert and knowing every single thing about it. I read 25 years of papers on this topic. I can quote every single paper because I'm in front of my peers who know this stuff just as well as I do. So to me, that educational aspect, selfishly, keeps me on top of my game in terms of keeping updated. And I also just enjoy it. I enjoy the higher level of teaching. So when I'm teaching a surgeon who's an orthopedic surgeon who has 30 years of experience, we don't talk about anatomy. We talk about really cool things like, when I put the suture here, I hold my hand this way, I stand this way, my assistant stands here, I pull the suture out with my thumb, and I use my thing. It's like the next level. It's kind of cool to go back and forth. And selfishly, I learned from these guys as well. Yeah, like I went to Oakville 2 3 weeks ago and taught a surgeon there a new technique, and I came back with a couple of things that he did in the OR that I thought was kind of cool. So I learned from that myself. So it works kind of both ways. So I think it's really important for me to stay on top of my game by doing these, and I also in turn learn a lot in return.
Yes, speaking of learning from other doctors, I want to ask you what aspect of foot and ankle surgery do you find the most challenging specifically?
At this point, I've done kind of everything so many times. I don't. The only thing to this day that now that I'm 10 years in that I'm I wouldn't say get nervous about, but I'm like a little bit extra focused on would be a big revision ankle replacement. So if an ankle replacement has failed, going back in, taking everything out, putting a new one in is right now the one thing that challenges me the most because it's something I've only done a handful of times. The hard operation, the high risk operation doesn't work. The patient, in some cases, needs an amputation. So it's like high risk, high reward, and technically challenging, intellectually challenging. That's the one thing right now that to this day the only thing probably at this point where the night before I review everything again. I don't do that anymore. I just review my patient's chart the night before. I don't review the surgical technique anymore. But that's the one thing that I still go back on and I learn myself the night before just to make sure I have every single step and make sure it runs smoothly.
Mhm. It's nice to see that our surgeons are working so hard and that our healthcare's in good hands. We knew you'd be amazing, but this is like a step further, Dr. Desai. I saw a post on your account the other day. I didn't even truly understand it because it was a little complex. You were doing minimally invasive Achilles surgery in that post, and you also had like an animation to explain how it's done. That's an emerging field in medicine right now, and outcomes are even better sometimes for patients who have these types of surgeries. Where do you see this going in the future, in 10 years, in 20 years?
I don't know, right? And that's the interesting part, right? Is like I finished my fellowship in 2015, right? So we're 10 years away. And I look back and I look at my like I look at my OR list now. Um, I would say about 60 to 70% of what I do now, I never learned in residency, or like everything changes. Like over even 5 years, how I do all these surgeries have changed. Most of it is more patient specific stuff, minimally invasive stuff, or new techniques that have emerged. So where we're going to be 5 years from now, I don't know, and that's the kind of cool part about it is I have a good idea, but you don't really know. I never realized 7 years into practice, 8 years in practice, 70% of what I do is I've never taught before. I have to self learn, right? So who knows what's going to happen 10 years from now? It's probably be 70% different again. So it's just a matter of kind of staying on top of the technology while not abusing the technology. Meaning, the whole point is to start using technology to make it for our advantage, while still respecting the fact that certain things still work. Meaning, just doing things because they're cooler, they have 3D implanting because they have robots, because they have MIS, minimally invasive, isn't the motivation to do it. The motivation is, can we do these cool things? It's actually going to make it's actually going to help our patients. So that's kind of what I'm always in the back of my mind, not just doing cool things.
Yeah, exactly. And speaking of helping your patients, you founded a company called Proven Therapeutics. And I touched on it earlier. It's kind of, and obviously you can kind of elaborate more, but it's for the audience, it's a company that specializes in perioperative surgical nutrition to help patients optimize their outcome from surgery. So could you kind of explain what your motivation behind Proven Therapeutics was?
Yeah, so I have a fitness and nutrition background, and I've always had an interest in it. And I think 5 years ago, so I take care of a lot of different athletes at different professional levels. And about 5 years ago or so, in my athletic population, I would start supplementing them with certain things before and after surgery. Um, you know, Various different minerals, all these types of things. For me, it started with like vitamin C. Vitamin C is very simple. A lot of studies show that it actually helps patients manage their pain after surgery. Added vitamin D for bone health. Added, creatine for muscle wasting. The bottom line is I started adding all these things to my patients, and it just became so overwhelming. I said, you know what? Let's just buy an over-the-counter product that's available. My patients can drink it before and after surgery. I'll have everything possible that I want in there, and that's it. Instead of having them take 17 different things plus their narcotics, their anticoagulation, and all this stuff after, it just became too much. And a very very long story short, that product didn't exist, and that's why myself and my colleague, I was friends with in med school, is an anesthesiologist, and we just created one. And it's something that basically has the basis of immunonutrition, which has been studied for about 30 years now to be helpful for patients. So it's immunonutrition, which is amino acids plus omega 3s is immunonutrition. Then we also added things that also have evidence around surgery, like I mentioned, vitamin C, creatine, all the other things, to create a super product that our patients can take before and after surgery. And it really selfishly was just for my patients, but then once we realized there's a gap in the market, we just turned it into a company, and now we're distributing it all over Canada.
Yeah, I think it's a very interesting idea, and um, I believe when I first texted you is when you were first launching the company. So it's very interesting that you were able to successfully launch it. And I had a question about why you wanted to or did a master's in medical biophysics. And now I'm even more interested because a lot of doctors actually end up doing an MBA or a PhD, just to get a better business background from an MBA. So why did you not pursue an MBA? What was your motivation behind pursuing a master's in medical biophysics?
Yeah, the motivation was more during my at Western. I did my residency at Western, and the third year we have a 6 week block of research, and a 6 week block of research was 6 weeks straight of just doing research and publishing. And I chose to go through specifically kind of implant design because I thought it was interesting. And at that time, Dr. Graham King, who is a world expert in upper extremity, one of the most well-respected guys in the world, he had a lab, and I just worked with him for the 6 weeks. And I just kind of went pretty hard. Like I went kind of 6 a.m. to midnight every single day. And by the end of that 6 weeks, I had produced enough to actually write a master's. So Dr. King said, we're going to publish about 6 papers from that 6 weeks. Why don't you just go through the master's process because you did the hard part? So then he's like, it was, and they're going to pay for it for me. So it was like literally a no-brainer. And all I had to do was go through the coursework because the hard part was done writing the papers and doing all the benchtop studies. So the motivation wasn't really necessarily that I wanted to do it. It just kind of fell into my lap because of how successful that 6 week period was. And it turned out to be great. It was ended up being a lot of fun. We ended up publishing, I don't remember now, I think at least between 6 to 8 papers through that master's. I got to work with Graham King, who's the man, and it worked out really well. And I think it kind of somewhat fell into my lap. It wasn't necessarily pre-planned.
That is super impressive though to complete like a master's worth of work in 6 weeks. I don't know how
He had an amazing team, and we worked really hard. Like it wasn't just me. It was just incredible. They had a machine. It was like there were students, master students, a bunch of us just worked together, and yeah, we accomplished a lot in a relatively short period of time.
Mhm. And you've done a lot in your career. We've talked about all of those things in this interview. We've talked about building businesses, building an online presence, even getting a master's. What advice would you have for other students, trainees, professionals who are looking to build a brand or a business?
That's a good question. Like I've been asked that question before, and I don't know the right answer because just like the masters, it wasn't like me and my friend, you know, sat down one day and said, let's just start throwing some ideas in a piece of paper. Um, I'm an orthopedic surgeon, and this just became kind of organically became an idea. Um, about say 3, 4 years ago or so, I think most people get in the same situation where you're kind of 7 to 8 years into your career, um, and things just naturally, you guys aren't there yet, but naturally get a bit repetitive. Um, like I love surgery, but I do a lot of this. I mean, I do probably 60 different surgeries, but I do them so many times that it gets a little repetitive. And I love it, but it gets a bit repetitive. And I remember about 3, 4 years ago, I kind of grabbed 3 or 4 of my most successful friends. When I say most successful in different areas, not in medicine. One guy's in business, one guy's in real estate, one guy's here, one guy's there. And I just kind of took them out to dinner. They're all like, extremely well off and they're in their 60s, and I bought dinner for them because they're spending time for me. And I just started picking their brains about, what was their motivation behind what they did, and if they had any advice for me. And it was interesting. One guy was a real estate, one guy was owned clinics, one guy was a banker, one guy was uh, owned a trucking company. Like they all extremely successful, and they also did the exact same thing to me, which is interesting because it was the exact same advice. They're like, "You're a surgeon. What you guys do, 0.1% of people in the world can do. Don't start kind of jumping outside of what you spent your entire life training for." And they all said the exact same thing. It was kind of weird. They're all the same thing. So like, if you do decide to go into business at one point, do something within what you're already doing. Like take a branch of what you're already learning, what you're already doing, what you do day to day. If a business opportunity comes up, let it be something related to that because you already have the expertise in that. So this nutrition thing came up. Again, it wasn't like something we thought about and brainstormed. It was an organic idea. My patients needed something that they weren't getting. The market did not have that. So I slowly developed something just for them. Next, it's a business. It wasn't forced at all. It wasn't planned. It wasn't forced. It wasn't something that I had to do financially. It wasn't something that, I was desperate to get out of orthopedics. It just happened. I think the best advice is, if you do want to go down that path, is number one, for you guys, like you, again, just like me, you went through high school, university, medical school, then you go through residency, fellowship. You're spending your entire life in a specific field. Don't just start, starting a real estate business unless you really want to. Use something within what you've spent 20 years of training for. And that's what I did. I used my medical degree. I used my nutrition knowledge. I used my surgical knowledge. I used my surgical connection. I used everything that was already trained for 20 years and created a company out of that. And that would be my best advice: is just let it happen organically and let it happen at the right time. Like, don't force it. Make sure you get through. Like, the goal here is to become a great surgeon. And then once you get into that wheelhouse and you feel good, that's when you can maybe start playing around with other things. You don't start doing things too early and lose focus on what you're supposed to. What the main goal here is to be a great technical surgeon, right? So that would be my best advice.
Those are wise words, and I'm certainly inspired by what you've just said. I think we apply kind of that same philosophy to MedBoys, our social media page, which is that, although we kind of explore many different types of like content creation, at the end of the day, like what we really are passionate and what we care about is medicine. And I think that will always be like the foundation and the root of everything. And I think that exactly applies to the point about focusing on this goal of being the most technically skilled and the best surgeon possible, as opposed to exploring all of these different avenues that are possible at an earlier time and potentially taking away time from, getting to be the best possible surgeon for your patients. So with that, I think that'll be the end of this podcast. We've come to the end of our questions. So thank you so much, Dr. Desai, for your insightful words. I'm sure our audience, as much as us, are all inspired by everything that you said. I hope those of you who are considering orthopedic surgery, you have to be swayed by what Dr. Desai has had to say. So thank you so much, Dr. Desai, for your time.
No, thanks. Thanks for having me, guys. I checked out some of your content. Similarly, I think it's pretty cool you guys are able to do this stuff on the side on a Tuesday night. I know you guys have other stuff to do, so it's pretty cool you guys have spent the time to do this, and I think you've done a great job. I think you guys reached out to me a year ago and I was just too busy, and then a year later, it's kind of cool to see how much you guys have progressed in a relatively short period of time. So congrats on what you guys are doing.